Hello, everyone, and welcome to Lupus You, Answers, Advocacy, and Action. My name is Zach Feuerherd. I'm the National Development Director here at the Lupus Foundation of America, and I'm excited to be your host. We have a fantastic program tonight, and tonight's program will focus on lupus and the heart. So we go to the next slide. So before we get started, I want to make sure we thank our sponsor, our presenting sponsor, Exogen. It's with sponsors like this that programs like this one are possible and free to the public. So we want to say an extra shout out and thank you to Exogen, our presenting sponsor tonight. Next slide. All right, so before we begin, I want to do a couple housekeeping items. I want to make sure tonight is fun and interactive. Everybody has a great time. So there's going to be lots of opportunities to ask questions. So make sure you submit your questions for our speakers via the Q&A section in the webinar. So if at any time you have a general question that you would like to submit to our speakers, you could send it through the Q&A function at the bottom of your screen. Just click on it and type in your question. If you'd like to submit your question without providing your name, you can actually do that anonymously, and that's available. And we'll have time as well allocated at the end where our speakers will be able to answer submitted questions from the audience. If you have a question that is more specific, you can always reach out to our health education specialists at lupus.org/healtheducator. And again, we want to make this interactive. So we have a chat function at the bottom of your screen. So make sure you chat it up if you have questions. We have some fun polls as well. So make sure you participate in those. And then finally, this program, I'm sure everybody's wondering if you signed up or you have a friend that couldn't make it. The program tonight will be recorded. So you'll receive a link of this recording along with helpful resources and a post-event survey where you can submit feedback about tonight's program. And I really do encourage everyone to take that survey. That's how we improve these programs. So please consider doing that afterwards. Okay, next slide. So I just want to get everybody to do an initial poll. Hopefully this will be pretty easy. So if you could launch that poll. The first question I want to ask everyone is, what day of the week is it? So is today a Wednesday or is today a Thursday? Okay, I see everybody responding. Almost 80% of our attendees. We'll give another 10 seconds here. Okay, so why don't we close the poll? So this was actually a trick question. There was no wrong answer. Most people selected Wednesday, 99% of people. But there was one person that actually said Thursday, and that's because we had over 800 people RSVP'd for today's webinar, and that included not only people in the United States, but actually people all across the world. So for at least one person, today is Thursday, so happy Thursday to that person. So everybody, thank you for taking that poll. Let's go to our next slide. So again, I'm really excited about tonight's program. You're going to hear from some fantastic speakers. We have Dr. Jim Oates, who's going to discuss lupus and the heart. We have Dr. Deborah Zack, who's going to share more about monitoring lupus activity as it relates to lupus and the heart. Then we have Dr. Christine Lee, who's going to talk about how being heart healthy with your doctor is important. And then we'll have a moment of motivation, we're calling it, with a very special guest, and that is Shannon Boxx. So we'll talk more with her and learn more about her story. So next slide. So I want to share some more information about resources and how you can get involved with the LFA. So let's go to the next slide. So you, the person with lupus, and caregivers and friends are the heart of everything that we do here at the Lupus Foundation of America. People affected by lupus represent the heart and soul of our foundation. You're the central focus of everything that we do and are a constant reminder of our mission's urgency and to serve to motivate us to continue this fight. We understand the emotional turmoil and economic hardships and physical suffering that lupus can cause. And because of you and myself and my colleagues, we're motivated to work harder and faster every single day to bring lupus under control so that everyone can have a life free of lupus. That's our vision. And to put this simply, our goal at the LFA is to one day end the impact of lupus and its suffering, while ensuring that we provide the comprehensive support and programs people with lupus need today. So that's why we're doing what we do. So next slide. And these programs, they stand upon three pillars, as you can see on the screen. So we have research, care and support services, and advocacy. We've redefined lupus research to expand our efforts beyond just funding research grants. We're really engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome those. And we do this while providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. So next slide. So a little bit more about our research. Our research, again, is patient-centered, and it's focused on transforming lives. We call it the 3 C's. So we have 3 goals: identify the causes of lupus, discover better ways to control symptoms, and then ultimately find pathways to cure lupus. And to do this, we really have to attack lupus from every direction through advocating for sustained lupus research funding, directly funding research that impacts people's lives and brings together lupus experts from all different areas. And just a couple examples of how we've been working together to make a difference. For example, we established the first national childhood lupus research program. We've successfully advocated for $615 million for lupus research. And we've invested nearly $4 million in a promising research study for stem cells as potential treatments for lupus. And by working together, we are bringing us closer to that vision, which is a life free of lupus. So next slide. And we're really excited about this initiative. It's called RAY. And for people with lupus, this is so important. They're vital to the research process. And that's why we've developed, it's a new online research platform called RAY. And the acronym stands for Lupus Research Accelerated by You. We've made significant progress in lupus research, but we are far from over in our quest to solve this cruel mystery. And researchers, they really do need your help, and you can help advance lupus research right from the comfort of your own home, which we're all doing right now, and share your lupus experiences with lupus to help inform future clinical trials of new lupus treatments, and then identify the most pressing needs of people with lupus. And no one understands lupus better than those living with it. So within that tool and that platform, you can compare your lupus experiences with others. You can get updates on new research studies. You could share medication and health information with your doctor. And you can help brighten the future of people with lupus and the future of lupus research. So if we go to the next slide. So just shifting gears a little bit, I want to share briefly about some of our programs and resources. This one is really important and a great resource. That's our National Resource Center on Lupus. And this is your one-stop resource for all things lupus, from treatment to living and coping with the disease. It aims to ensure that anyone affected by lupus, including people diagnosed with lupus, caregivers, healthcare professionals, all have access to high quality resources that provide emotional support and clear, accurate health information. Next slide. Our health education specialists, many of whom are on this call tonight answering questions and in the chat box, they are certified health education specialists who are trained to provide people with lupus, their families and caregivers with non-medical counseling, disease education, and helpful resources. Our health educators can help you find trustworthy information to answer your questions about lupus and how to cope with it. Again, this is a fantastic resource. And to contact a health educator, again, we'll be sending out these slides and you'll have this information, but you can fill out our form at lupus.org/health educator. You can call them at 1-800-558-0121, extension 136. So maybe we'll have them put that in the chat box so that everybody has that. Okay, next slide. Okay, so our Take Charge email series, this is a 12-week education email series for people with lupus, including those recently diagnosed. And when you sign up for this email series, you'll get an email from our health education specialist, which we just talked about, and you'll get tips and resources that can empower you to take charge of your health. The series covers important topics such as identifying and tracking your symptoms, sticking with your treatment plan, and getting the most out of your doctor's appointments, which is just a few of the things that this series covers. So next slide. And we really do have so many programs and resources available to you. The Expert Series, which is a monthly educational podcast. I know how much everybody loves podcasts these days. So we have our own podcast where our team interviews experts in the field about topics that are important to you. And more than 150, so we also have a large network of support groups, which, pre-COVID, pre-pandemic, met in person. So right now, most of those are meeting virtually. So we're hoping to go back to those in person relatively soon. But we have over 150 support groups across the country where people with lupus can come together, ask questions, and listen to each other. And then finally, we have Lupus Connect, which is an online support community where members can engage with each other and ask questions. So next slide. And just a couple other ways to get involved. We have our Walk to End Lupus Now program. And I'm sure so many of you on the webinar tonight have participated in one of our many walks across the country. And this year we'll be walking virtually from coast to coast nationally on Saturday, October 16th, 2021. So 10/16/21. We also have what's called our Make Your Mark program. It's our community fundraising program. It's a way to turn an event into a fundraiser for lupus. An example I heard recently was someone did a big cornhole tournament and raised a lot of money. So really anything that you're passionate about, you can turn it into a fundraiser through Make Your Mark. We have our Virtual 6 Challenge, where you complete 6 miles over 6 days, however you choose. You can hike, jog, bike, paddle, swim. So to be a part, it's from August 23rd through August 28th is that challenge. And then finally, this is a really important piece too. Your voice is really one of the most powerful tools that we have, that you have. We are the leader in stimulating federal support for lupus, generating more than $615 million for lupus research and education in the past 5 years. So every day we fight to ensure that our government is responsive to the needs of the 1.5 million Americans living with lupus, and you can certainly sign up to be an advocate as well. And then finally, you can get involved locally in your community. We have a chapter network and regional network of offices and staff members. You can find more information about those areas by visiting lupus.org/chapters. So if you go to the next slide there, that was the one I was just, yep. Okay, next slide. So again, we'll have this sent out to everyone, but this is just some more information on how you can reach us on social media, which is a great way to just stay involved instantly on what's going on with the LFA and in all the programs and services and events that I've mentioned tonight. So with that, I want to take another poll before our first speaker. So let's launch that poll. So the question is, have you ever experienced heart or cardiovascular involvement with your lupus? Okay. We've got just about 70% of people who've already voted. Give everybody another 10 seconds here. Okay, final chance. Okay, so let's close the poll. So the results are, so the question was, have you experienced heart cardiovascular involvement with your lupus? 52% of our attendees said yes, 31% said no, and 17% said I'm not sure. So let's close that. Thank you for participating. And let's go to our next slide. I'm excited to introduce our next speaker, our first speaker. He is a general training. He has general training in immunology and autoimmunity with specific expertise in lupus nephritis, endolethal dysfunction, biomarkers, and predictors of lupus nephritis outcomes, and atherosclerosis in lupus, and the role of reactive intermediates in lupus nephritis in atherosclerosis. So hopefully everyone got that. He is currently a professor of medicine within the Medical University of South Carolina's Division of Rheumatology and Immunology. So I'm excited to introduce Dr. Jim Oates, who's going to be discussing lupus in the heart. So Dr. Oates, I'll turn it over to you. Well, I'm actually not sure if Dr. Oates is on the line. So we are going to pivot here and we're going to go to our second speaker. And if we get Dr. Oates, we'll come back to him. So our next speaker, we go down. She is a board certified rheumatologist with broad experience as a strategic biopharmaceutical executive in the development of therapeutics for autoimmune disease, and she oversees the overall strategy and execution of Exagen's clinical development plans. She has extensive experience leading research, clinical development, and medical affairs teams focusing on autoimmune disorders. So today she's going to be presenting some more information or some information about monitoring lupus activity as it relates to lupus and the heart. So please help me welcome Dr. Deborah Zack.
Hi, pleasure to be here. Dr. Oates is on the line, Zach, by the way. So maybe you guys can find out. He says he's on the line. He doesn't have camera or audio, so he's stuck in some.
Okay. Okay, we'll work on that while you present.
Yeah.
Thank you.
Sure. Thank you all for being here. It's exciting to be able to present a little bit of what we're doing to all of you guys who have to fight daily with lupus and fight daily with the disease. Next slide, please. I'm supposed to cover a little bit of some of the things that you can monitor for your lupus activity and some of the tests that are out there. In order to do that, I wanted to start by just reminding you of a couple of things. We measure a lot of autoantibodies in lupus as a way to identify both the disease itself with some of these, and also the potential risk for various organ involvements with some of the more specific, with some of the other specific antibodies that we look at in the lab. Some of these, for example, are anti-double-stranded DNA, which most of you probably have had a test for at some point. It's very specific for the diagnosis of lupus. Unfortunately, it's not all that common. So maybe only 30% of patients or so will have a positive anti-double-stranded DNA. Anti-Smith, all of these have very funny names. I apologize for that, but that's just the way they were named in the years in which they were discovered. And so anti-Smith, the second one on there, is also very specific for the diagnosis of someone with lupus, but it only shows up in about 15% of people. So, you know, one of the troubles that we've got as physicians in this area is to be able to examine you, look at your signs and symptoms, and select tests that will help fill in some additional gaps, as well as what you might, what antibodies might be helpful to tell us just a little bit more about what tissues might be be damaged and, might be at risk in your symptoms. The autoantibodies themselves bind your own tissues. That's why they're called autoantibodies, and they trigger inflammation. We'll speak about complement. You've probably also seen C3 and C4, which are 2 of the 9 complement components. And when the autoantibodies bind your tissue, they cause a cascade of these complement proteins, which leads to additional inflammation and triggers your body to send in the troops, which is something that we don't want to have happen, because then those various tissues can be damaged. Next slide, please. We know that getting a correct diagnosis for lupus is very important, but also monitoring and treatment is important. And if we can diagnose and effectively manage lupus, it's been shown that there are much improved outcomes: fewer flares, less severe flares, lower rates of hospitalization, less damage accrual in the tissues. So those are all very important. Next slide. So what can you do to help this? The obvious, and I think the other speakers are going to talk about a few of these. Smoking, obviously, is not good for any of us. A healthy diet. Sun sensitivity is frequent in lupus, so avoiding the sun. If you have high blood pressure, diabetes, or cholesterol issues, getting those things under control and making sure they're managed well. Staying on your meds. Hydroxychloroquine has been shown to lower the risk of renal damage and the risk for blood clots in long-term studies. So it's very important to maintain your meds and to know to have a partnership with your doctor so that you can sustain those things and lead to improvement and keep that damage index down. The not so obvious is monitoring for disease activity, which is the best way to prevent damage to the cardiovascular system and to kidneys. But those things have been kind of slow to come along in the rheumatology area. So what can you do that might improve your quality of life? I have a couple of things that I'd like to suggest that maybe you discuss with your doctor. Next. You've probably seen, for some of you out here in listening, some patients, their levels of anti-double-stranded DNA antibody and complement components do fluctuate. And this is pretty often with kidney activity. However, it's true for only a low number of you, maybe 30%. There are other autoantibodies that aren't so well known, perhaps, that can also identify and help monitor organ inflammation. We'll talk about anti-C1q in a moment, which also helps with monitoring of kidney disease. Assessment of antiphospholipid antibodies, since today's topic is about the heart, though they may help suggest an increased risk and increased look into any kinds of things that can be changed to help reduce the risk of blood clots. One of the things that we do here at Exogen is an advance in lupus diagnostics and management that is like the newest kid on the block. Sue Ahern and Joe Ahern and Sue Manzi, both rheumatologists in Pittsburgh, discovered that you could look at blood cells and look at pieces of these complement components that stick to them, and the level of the numbers of those products on the red blood cells fluctuates with level of inflammation up and down. So it's a nice way of being able to monitor lupus activity. B cells also can have these little products on them, and platelets can. So there's a number of ones that we offer that may help look into how you're doing with those areas and to be able to better follow the level of activity. There's a lot of recent research. Zack talked a little bit about some of the things that Lupus Foundation has been involved in, and there's many others. And the recent research is very exciting, and it may give us much better tools in the future as we go on, trying to find the best ways of being able to monitor and nip those flares in the bud. Next one. Okay, so we've talked a little bit about autoantibodies, autoantigens. These lead to inflammation. When those autoantibodies bind your tissues, I talked a little bit about the complement cascade starts. And what happens is those things, as that cascade unfolds, is that they recruit other inflammatory cells in. So they call the troops into there, and that's what causes the organ damage. What Joe Ahern and Sue Manzi found was that as this occurs, as this the autoantibodies and complement interact, little bits stick to tissues. They stick to particular cells. So down here on the bottom of the slide, I've shown you a red blood cell. Over time, maybe a little bit of, on the left, little tiny bit of activity. So a couple of these. And then as you have increasing disease activity, more and more of these will bind to each cell. And we can measure these in the lab so that we can see if there's 1 or if there's 15. And that gives us an idea of how much activity has been ongoing during the past couple of months. The red cells live 3 months, so it gives you an idea just in the immediate past. And likewise, if the activity is decreasing, over time, we'll have less and less of these little bits of protein stuck to the red blood cells, so we know that things are improving. Next slide. This is a shorthand for erythrocyte C4D. So that's that little protein marker on a red blood cell. It does trend over time to help provide insight into lupus activity. C3 and C4 are really not very helpful in about 3/4 of lupus patients because they're either persistently normal or they're persistently low. And so it doesn't give us a good idea of activity. C3 and C4, I noticed somebody was asking if it's when they're found to be high. And no, C3 and C4 high is not really often found in lupus, but there's a number of reasons for why C3, C4 fluctuate. So those proteins themselves aren't that great, but once you've got this disease activity, the numbers of those little protein pieces actually correlate very well with renal activity and with general lupus activity as lupus patients are monitored prospectively. It can also serve as an objective indicator of improvement following a therapeutic intervention to see if the medication is actually doing something to decrease the activity. Next slide. Anti-double-stranded DNA antibodies, we talked about those a little bit as being very specific for lupus. In the context of lupus, there's a number of different ways to measure anti-double-stranded DNA antibodies. And we use one system for the diagnosis tests that we provide, and then others are much better for tracking lupus activity. So we've selected one, and you can see the blue line and the red line overlapping down here. That's just showing that the anti-double-stranded DNA level is pretty closely mimicking what the SLEDAI score is, which is one of the lupus activity measures that we utilize in looking at lupus patients. So this particular method gives a much more dynamic range so that we can see small levels of improvement or if it's getting a little bit worse. Next one. Anti-C1q I spoke about just a little bit at the very beginning. This is a bit of a newer antibody as well. In the context of lupus, it's significantly associated with lupus nephritis. So it's one of those things that you can get maybe a hint that we need to be looking very closely at the kidneys. And it provides additional insight beyond the double-stranded DNA and C3C4. So it's an additive risk factor. And it's been shown to track closely with improvements in both renal inflammation and kidney inflammation as patients are treated with immunosuppressants. So it may also give another clue and help to monitor disease activity. Next. So this is my last slide. Be an active partner in your care. Stay posted on our website. On the Avise website, we'll be rolling out a new tool for you to potentially use with your physicians sometime in the fall. Talk to your doctor about a monitoring plan based on what your symptoms are, so that you are keeping track of it at all times, because the better you're monitored and the better you're treated, the better the outcome is. Learn all you can about your disease from reputable sources, and don't give up. There's so many new things coming out. There's new treatments coming along, and new ways of testing that are likely to hit in the next couple of years. And we're excited to be on this journey with you. Thank you very much.
Great. Well, thank you so much, Dr. Zack. And we've already got many questions coming in for you, so we'll save those for the panel, but thank you for that presentation. Let's take another quick poll, and we have Dr. Oates. So the next poll question is, what tests will your doctor run if you have symptoms of heart problems? Would it be blood tests? So we'll launch that poll. Would it be blood tests, chest x-rays, an electrocardiogram, an echocardiogram, or all of the above? Okay, so why don't we close that poll? Yep, so everybody basically had the right answer. So the correct answer is actually the last option, all of the above. And we're gonna, as you saw in Dr. Zack's presentation, just why that's so important. Okay, well, I'm gonna reintroduce Dr. Oates again. Let's see, Dr. Oates. Turn on your video. Okay, so again, Dr. Oates is in general training, has general training in immunology and autoimmunology with specific expertise in lupus nephritis. And he is currently a professor of medicine within the Medical University of South Carolina's Division of Rheumatology and Immunology. And he is going to talk today specifically about lupus in the heart. So Dr. Oates.
Hi, sorry about that earlier problem. I was a very happy yet mute and invisible participant. I used a participant link, so my apologies. Today I'm going to talk about lupus in the heart and give you a little context for why we're interested in monitoring our lupus disease activity as a way of controlling heart disease. I'm not just speaking to the 52% of you who have clinical heart disease. I'm also speaking to the 48% of you who have yet to have a problem, so that you won't end up with a problem that's clinically noticeable. So let's get started. Next slide, please. First thing I wanted to do was to orient you to the process of atherosclerosis. People may call this hardening of the arteries or clogging of the arteries. And when your organs don't get enough blood because the blood flow is blocked, you have things like strokes and heart attacks. So this is a blood vessel depicted here, and on the left is early in life, and you can see that on the inside of this cross section of the artery, there are some cells. They're sort of peach in color here, and they line the artery like Teflon, and they prevent clot and they prevent inflammation. But as life goes on and you move to the right here over the years, cholesterol develops under that cell lining and clogs the artery. And sometimes these plaques will rupture and you'll have an acute clot there. Yeah, and that's what we call a heart attack or a stroke with sudden blood loss to the organ. So the goal is to catch it early on in these first two segments, not allow it to progress to these last two segments. Next slide, please. So these Teflon cells that I was talking about are endothelial cells, and they carefully monitor your bloodstream for signs of inflammation, such as the one referred to by Dr. Zack. And when they sense it, they become activated, and they actually actively call immune cells into the arteries or into the lining of the artery. And those immune cells become activated and they gobble up cholesterol. And that cholesterol stays in the plaque. So our goal is to make these endothelial cells happy. And I'll tell you about how to do that later. Next slide, please. So I'm sure you all know or have family members or doctors that have told you about the traditional risk factors for heart disease and strokes, things like smoking, diabetes, high blood pressure, too much weight, particularly too much weight in the middle. So you can see this picture on the right of the apple versus the pear. Folks who have estrogen distribution pear shape with more of the fat sort of on the thighs and the buttocks than in the middle region are better off. The ones who have the fat in the middle region, that's a different kind of fat. It's more inflammatory and it's more of a problem for developing heart disease. If you have a family history, you're at a higher risk. If you are inactive, you are at higher risk. That's the new smoking. And you can see that with this individual on the couch with his socks sticking out. If you consume too much saturated and trans fat, and I'll talk about that in a minute. If you eat too many processed foods, and I'll talk about that in a minute as well. Next slide, please. But in lupus, heart disease actually happens in addition to and independent of those risk factors that I mentioned on the previous slide. So this slide depicts that folks up to the age of 40, up to the age of 50, 60, and 70, lupus patients in purple, of course, since this is presented by the Lupus Foundation, and non-lupus controls. And what's presented in the height of the bar is plaque that's present in the arteries in the neck that go to the brain. And they mirror nicely the arteries that go to the heart. And you can see that more than double in some instances the amount of plaque in patients with lupus than non-lupus controls. And what this tells us, many of these people do not have clinical disease. So this is atherosclerosis happening over time. And this is an opportunity in my mind to prevent it. Next slide, please. So lots of studies have looked at things that associate with heart disease, and I've studied that in my laboratory as well. But things keep coming up over and over again. One is the longer you have lupus, the longer you're exposed to lupus activity, the more likely you are to have this heart disease. The more damage you have from lupus. And this may be a surrogate both of active disease and use of prednisone, actually. So the more prednisone that you use, the more likely you'll have problems. Less use of immune suppressing medication. This may be a surrogate for letting your disease activity remain high or grumbling, if you will. And less hydroxychloroquine or Plaquenil use. So this drug is actually protective. Over and over again, studies show that folks who are taking this medication are less likely to have heart attacks and strokes than those who do not. Next slide, please. So I've given you a bleak picture, more than double the instances of heart disease. What do we do about this? It's not all gloom and doom. There are a couple of things you can do that are simple. One is, unless you have an allergy or intolerance to it, or have an issue with your eyes that typically happens much later, years into treatment, if it happens at all, you need to take the hydroxychloroquine or Plaquenil that's been prescribed by your physician. And work with your doctor to treat to target. As was mentioned in the previous talk by Dr. Zack, It's a collaboration between you and your provider to try to make sure that your disease is under control, that you tolerate your medicines, and that you work together to find something that works and that you tolerate. And avoid long-term prednisone. We all feel great on prednisone. I've taken it myself for sinus problems, and boy, you can really clean out the garage and you have lots of energy and all your pain goes away. But it's a bad drug to take long-term. It has lots of toxicity that folks don't like to talk about because there are no commercials about prednisone. Next slide. The other is to remain active. And you know, our modern environment is not set up to do that. We have escalators, we have elevators, we drive in cars. Our roads are designed so that there's no room for pedestrians on a lot of roads. So you need to work hard to try to figure out how to get some of that activity in, and I'll talk about that in a minute. And the other is to eat a healthy diet. We'll go into that as well. Next slide, please. So these are all things that we can do as individuals. Part of the reason this is so hard is the food that we take in has changed over time. So back in the early 80s, we were told that we should consume low-fat foods and it was okay to consume carbohydrates. And back then, states like the one that I'm in now, South Carolina, led the obesity epidemic with 10 to 14% of individuals with over a BMI of 30. But by 2008, next slide, you can see that this has changed dramatically. So over 30% in our state are now obese and overweight or obese. And the reason for that in large part is the diet that we are presented in the store. So on the left here, you can see the processed food aisles. These are all the good things that our brain really wants us to eat. And if they're in the house and it's 8 o'clock at night and you're sitting on the couch, you will eat them because that's what our brains tell us to do. But unfortunately, it's not what we need to be eating to avoid heart disease. Next slide, please. What we should be eating is what we evolved to eat, fruits and vegetables, mostly fish, but poultry also, avoiding red meats. And if you decide to eat red meat, grass-fed is better. What I tell my patients, if it didn't have a mother and it didn't come out of the ground or off of a tree, you probably shouldn't eat it. And the way to know if your fats are, let's try again, if your fats are saturated or trans is if they're out on the counter and they stay solid, chances are that's not something you want to consume. If you want to have butter, there is omega fatty acid, omega-3 fatty acid, high butter that is better. Not all oils are bad. Olive oil is a great oil, avocado oil, etc. Those are liquid at room temperature though, so that's a good rule. Next slide. So this is what your diet should look like. So fruits, vegetables, olive oils, nuts, seeds, and fish. Next slide. This is what your diet should not look like. It is convenient, but if you actually prepare meals using the things on the left, it's actually cheaper over time and it's better for you. But it does take some planning, and that's not something that all of us have. A lot of our patients with lupus are caregivers for both their parents and their children, and they're trying to manage their disease. And, you know, when are we going to get this in? I understand that, but having knowledge is power, so that's why I'm here. Next slide. There are a couple of evidence-based diets that are useful for heart health if you are salt sensitive. A lot of our patients are. What that means is if you consume high salt, your blood pressure goes up. You can go on the DASH diet, and this is a low salt form of the Mediterranean diet. And the Mediterranean diet is exactly what I talked about, high fruits and vegetables, nuts, seeds, fish, olive oil. And there are lots of cookbooks that can help you with the Mediterranean diet. The Mayo Clinic has some guidance here. This is for a heart healthy diet. There's no diet that's proven to be, say, a lupus diet. But next slide. There was a study done looking at the effect of the Mediterranean diet on lupus patients relatively small number, but reasonable number, 280 lupus patients. They basically counted up how well people adhered to the Mediterranean diet, the number of fruit, vegetable servings, et cetera. Patients who were on this diet had less lupus flares and damage. They had less obesity and had lower triglycerides. It's yet to be proven that that prevents heart disease in lupus, but it does in non-lupus patients. And the things it does do are associated with heart disease. So I say go for it. Next slide. And it can be difficult to figure out how to do this. On the right side is a nutrition label. And one easy rule to follow is if what you're picking up has a label like this on it, you probably shouldn't be eating it. That means it's processed food. The FDA does not require you to label things on the left. And these are all found on the outside part of the store. So usually when you're walking in, there are fruits and vegetables, and then you may have meats and dairy in a different part, but all on the outside part of the store. So if you shun those inner aisles that have these nutrition labels, you will do better if you want an easy rule to follow. Next slide. So how do we remain active in a society where we've evolved to use ATVs to get to the store 2 blocks away? And I've seen it in my neighborhood. First of all, walking is sufficient. So think about what you do in a day. If you have the opportunity to take stairs, do. Instead of parking as close as you can, park as far as you can so you get that walking in. But walking in and of itself, fast walk, certainly is more than a slow walk, and a slow walk is certainly more than sitting. And I don't put the calories up here to make you think about losing weight. Our goal with exercise is less losing weight and more staying healthy, because when you get your heart rate up, you make those endothelial cells I was talking about happy. And when those cells are happy, you're less likely to have heart disease. Also makes it easier for you to manage your glucose and cholesterol. Next slide, please. And another way to exercise without thinking about it is to wear some sort of activity monitor. It could be in a watch that monitors your activity, or a smartphone. But there are several things that you can do, and you monitor your activity and see if you can tweak your daily activities so that you get more and more steps in. So you might set a goal at 2,000 steps, and then 3,000, and then 4,000, et cetera. Trying to get 20 or 30 minutes a day, 5 days a week in, ultimately, of some kind of activity that raises the heart rate. Next slide. So they have done studies looking at the effect of exercise in lupus patients. And one of the biggest problems that my patients talk to me about is fatigue. And there are very few drugs that affect this, but exercise does. It's a little counterintuitive. You come home and you're exhausted by the end of the day as part of your lupus or because of sleep deprivation. But it actually, over the long run, helps with fatigue. It also reduces depression, and it's a heart healthy thing to do. Next slide. So the take-home points here is to work with your doctor to control your disease activity and avoid prednisone and take your Plaquenil. Eat smart and move. Next slide. There are resources through the Lupus Foundation and their resource center that was alluded to earlier. And there's some exercise resources there for you to look at. And I'll take questions at the end.
Great. Well, thank you so much, Dr. Oates. That was some great information. I love the section about trying to shop on the outside of the store. I think that's a nice tip and something to remember. So we have some great activity here in the chat. We're running a little bit behind schedule, and I'm excited to introduce our next speaker. She is a board certified physician in rheumatology and internal medicine. And in addition to her practice, she currently serves as co-investigator on 16 clinical trials throughout the Wallace Rheumatic Studies Center in Beverly Hills, California. And today she'll be discussing ways to communicate with your doctor about being heart healthy, which is really important. So please help me welcome Dr. Lee, Christine Lee.
Thanks so much, everyone. I hope you can hear me okay. So today we're going to be talking about just going off of everyone else's talk. We're going to talk about how to talk with your doctor about being heart healthy. Next slide. So where to start? So I want to just make a few definitions first. So first I want to talk about the patient-physician relationship. So it's really important for people with chronic illnesses such as lupus to establish a good relationship with your rheumatologist. So it's defined as a process in which information about the patient and the disease is collected, diagnosis is made, a treatment plan is made, the patient is ideally cured, or in our case, brought into remission, and support is offered to the patient. It's composed of elements such as knowledge, trust, loyalty, and respect. Plays a critical role in the prevention, diagnosis, and treatment of disease, and can really affect a patient's compliance with treatment. I really believe in the approach of shared decision-making, in which the doctor doesn't make the decisions about the treatment of the patient alone. The patient and the physician discuss their knowledge together and agree on the most appropriate treatment method for that patient. Next slide. So today we're going to talk about how to lower your risk of heart disease. And these are, again, questions and concerns you can bring up with your doctor. I know it's been touched on before with the other speakers, but we'll discuss again exercise, physical therapy, healthy eating habits, ways to quit smoking, and weight control. Next slide. So exercise and physical therapy has been emphasized already today. We know there's multiple benefits, both physical, mental, and emotional. Studies show that for individuals with lupus, regular exercise improves one's ability to function independently. Those who exercise report having a better self-image and are better able to cope with arising challenges. Exercise helps reduce overall fatigue from lupus and life in general. It can help decrease depression and anxiety, especially for those populations with chronic illness. Also decreases the risk of osteoporosis and helps maintain muscle strength. It can improve sleep, control weight, reduce the risk of diabetes and high blood pressure, and lower the risk of stroke and heart disease. We know these diseases here are also oftentimes comorbidities with lupus patients, so that's double important there. It also improves one's sense of balance, which is important for those individuals who may be higher risk for falling. Next slide. So what to expect with physical therapy? Oftentimes I hear my patients say, well, why do I need to go to a physical therapist when it's something I can do at home by myself? But actually there's a lot of benefits, and I encourage them to think about, working with a physical therapist to learn the exercises on what to do, but also to continue doing them after you finish your PT sessions. So ideally you want to find a physical therapist familiar with autoimmune disease. We know that the nature of lupus and its effect on one's ability to function on a daily or even hourly basis requires individualized treatment. What they typically do is they'll do a baseline testing of mobility, physical and functional limitations. Strength may be tested, as well as range of motion, balance, and a functional activity evaluation may be done. You want to set goals and expectations with your therapist, and depending on the level of where you are comfortable at or what your physical abilities are, aerobic exercises might be used, strength training, stretching, relaxation or breathing techniques, or balance training. And like I mentioned before, a lot of times people like what they do in physical therapy, but once they quote unquote graduate from the PT program, they don't keep up with it when they go home. So that's really important to keep that going. Next slide. So I know Dr. Oates touched on this a little bit, what comprises a heart healthy diet. This goes into detail a little bit more. So we'll talk about the different types of fats that can be found in one's diet. So you want to limit saturated fats to less than 7% of calories per day, which is about 13 grams for a 2,000 calorie diet. Now, saturated fats can be found from both animal and plant sources. Animal-wise, it's found in butter, lard, shortening, or fats in meats, poultry, or whole milk dairy products. In plants, it can be found in palm oil, palm kernel oil, and coconut oil. You want to look for monounsaturated fats as well as polyunsaturated fats. Monounsaturated fats include olive oil, canola oil, peanut oil, sunflower, sesame oil, avocados, peanut butters, and other sorts of nuts and seeds. Polyunsaturated fats contain essential fats, including omega-3s and omega-6s. This can be found in soybean, corn, safflower, vegetable oil, or sunflower seeds. You want to limit trans fats to less than 1% of calories. And I know Dr. Oates touched on this a little bit, but trans fats are those that are processed foods typically. You want to look for anything that says partially hydrogenated oils, and that usually is a hint that there are some trans fats in there. They can also be found in certain milk and meat products, as well as fried foods or bakery items, but more so packaged things like Hostess, Twinkies, that kind of thing. You want to limit cholesterol to less than 200 milligrams a day. And again, cholesterol can be found in fried foods or processed foods, desserts, meats, or full-fat dairy. Now, cholesterol is also found in certain good foods for other reasons, such as eggs or shellfish. But again, limit those to less than 200 milligrams a day. You want to limit sodium to 2,000 milligrams a day or less, and alcohol in moderation is important too as part of a heart healthy diet. So what is alcohol in moderation? It's typically defined as for women, less than 1 drink a day, and for men, less than 2 drinks a day. Now, this isn't a liter. Typically what's defined as a drink is actually only 5 ounces. So 5 ounces of wine or beer. So it's actually not that much, but something to keep an eye out on. Next slide. So what are other heart healthy foods and nutrients? As I mentioned before, omega-3 fatty acids. These consist of certain types of acids here that I'll just refer by their shorthand because it's easier to say. So ALA, DPA, and EPA. ALA is found in vegetable oils, nuts, seeds, and soy foods. DPA and EPA are found in fatty fish such as mackerel, salmon, herring, trout, sardines, or tuna. Soy protein can also be a good replacement for red meat or other types of meat proteins. Low-fat protein alternatives include tofu, edamame, soy milk. Fiber is also important for weight control and blood sugar levels. You should try to eat at least 25 grams of soluble and insoluble fiber daily. So soluble fiber is important as it can lower LDL, and LDL is the bad type of cholesterol. HDL is the good. Now, oatmeal, barley, beans, fruits, vegetables all have soluble fiber. Next slide. Nuts are also good in moderation too. 5 ounces a week is recommended. They're rich in monounsaturated fats, vitamin E, and magnesium. They can also lower cholesterol and triglycerides. Fruits and vegetables, goes without saying, provides fiber, antioxidants, folate, potassium, vitamin A, and vitamin C. Dark chocolate, yay, is good. 70% cocoa or higher is the best, although many people might find that a bit too bitter, but it is rich in cocophenols and flavonoids that can also help with a heart healthy diet. Green tea is also rich in flavonoids and can be a good replacement for coffee if you're trying to wean off of that. Next slide. As Dr. Oates had mentioned, the Mediterranean diet and DASH diets are all good heart healthy diets. So the Mediterranean diet emphasizes whole, minimally processed foods. This includes fruits, vegetables, whole grains, legumes, fish, and olive oil. It's high in fiber and antioxidants and low in red meat and high fat dairy. DASH, which stands for a dietary approach to stop hypertension. It is usually high in calcium, potassium, and magnesium, and low in sodium, saturated fat, and cholesterol. It's also high in fiber. If you want to try something new, vegan or vegetarian diets, which eliminate all sorts of red meat and sometimes eggs as well. They emphasize fruits, vegetables, beans, lentils, soy products, grains, nuts, seeds, and plant-based oils and fats. They can be a good choice and often are not as restrictive as one might think. They're high in fiber, antioxidants, and anti-inflammatory compounds, all of which can help with heart health. Next slide. Now we'll move on to smoking and why it's important to stop smoking for a variety of reasons, not just lupus related. But smoking can increase the risk of coronary artery disease and heart attacks. Many of these diseases are already you're at higher risk for if you have lupus, so it's double important to think about. Smoking can narrow blood vessels or cause blood vessel spasms and can worsen peripheral vascular disease, which can cause poor blood supply. For someone who already has Raynaud's, which is a vascular problem where your fingertips can turn white in the cold, which many lupus patients have, this is really important to avoid. It can also increase the risk of stroke and hypertension, as well as worsen heartburn. It can cause premature aging and increase the risk for osteoporosis. Those who are on high doses of prednisone or chronic prednisone are already at increased risk for osteoporosis, so you certainly don't want to make that worse in any way. Like I mentioned before, lupus patients are at increased risk for many of these problems that I just mentioned, so smoking can act as an accelerated risk factor. Next slide. So in summary, we know that lupus is a chronic multi-organ system autoimmune disease. You want to make sure that you find a good rheumatologist that you feel like you can establish a good physician-patient relationship. Know that you're in this together. And if you feel like you're not comfortable with your rheumatologist, there's other people out there that could help you too. And you really want to be honest with yourself and your doctor too. Aim for small additive changes, make one dietary or exercise change at a time. And over time, it may not feel like much, but you'll see that these changes do add up. I would suggest keeping a journal to document symptoms. Don't just focus on the negatives, celebrate the positives as well. So when you have a good day, write what you did or what made you feel good. Find a good support system, such as support groups within the LFA, family members, that sort of thing. And don't be afraid to ask questions. And that's it.
Great. Well, thank you so much, Dr. Lee. I was pleased to hear that chocolate is good for your heart. So
that's one highlight.
That's wonderful. I'll remember.
But anyways, no, that relationship with your doctor and journaling, those were some really good tips. So thank you so much. And now I'm excited to introduce our final speaker. We are extremely excited to have Shannon Boxx joining us today. Shannon was a member of the U.S. Women's National Soccer Team. She's an Olympian and World Cup champion, and she's also a lupus warrior. And today we're going to hear more about Shannon's story during our motivational moment here, and also have time to ask her some questions. So I'm going to turn the floor over to Shannon. And again, thanks so much for being here.
Hi, everyone. Thank you so much for having me on today. I am just so proud to be a part of the foundation as an advocate, and hope that sharing some of my journey, I can help motivate and inspire others to keep fighting. My journey began actually in 2002. I had just become a professional soccer player in our women's professional league here in the US. And I was in the middle of my season, and I started to feel this feeling of extreme fatigue that I'd never felt before. And I remember having to rest halfway up my set of stairs to my second-story apartment. And I thought it was strange, but I really didn't think that much about it until a couple of weeks later. I was at training, and here I was, this elite athlete, fit as could be, and I felt like my whole body was stuck in quicksand and I could barely move. And I remember walking off the field that day and being extremely scared because I knew that something was very wrong. And so after a few visits and the doctors and a whole lot of tests later, my flare had finally subsided, and I was originally diagnosed with Sjogren's syndrome. But the next couple of years, my flares and symptoms just kind of continued to get worse, and doctors were uncertain that Sjogren's syndrome was the only disease that I was dealing with. And all the while, I was continuing to play at the professional level, keeping my symptoms quiet. I even made the U.S. National World Cup team in 2003, the Olympic team in 2004, and the World Cup team in 2007. And those years, though, were some of the worst I'd ever been through, because I didn't know what was happening to my body. I was living in a new city every 6 months, which meant I was finding new doctors with different opinions of what may be going on in my body. And I remember just going into every single new appointment with this stack of paper, notes that I had taken, labs that I'd done, hoping that this next doctor would be able to give me some answers. And right before the 2007 World Cup, my blood work was at a scary enough level that the doctors were actually afraid to let me play in that tournament. Eventually, my one doctor consulted another doctor and they allowed me to play as long as I promised them that I'd go on prednisone for the entire tournament. And then finally, in the beginning of 2008, I saw a new doctor once again, and she finally had an answer. She immediately recognized. I walked in and it was like, you have lupus. I see all your tests. You have lupus. And I was like, when she told me, it was such this awkward moment because my first feeling was relief. And it wasn't because I had lupus, but it was because I finally had some answers. And I'm sure so many of you guys have gone through that feeling, but I now had something that I could start fighting. I knew what I had, all the feelings that I'd had since 2002. I can now start trying to figure out how to manage this problem and manage this disease. And, but the only problem was I knew nothing about lupus. I hadn't heard about it before. I'd never heard the term. I was clueless. And the other realization was I knew if I wanted to keep playing on the national team, I could never tell my coaches or my teammates about my diagnosis because I didn't know how to control it. So through the years, hiding something like that from my teammates who I was with for over 200 days a year became more and more difficult and mentally exhausting. Flares would come and I would have to find ways to hide the pain and the fatigue. And, I'll tell you one story is in 2010, we were at a World Cup qualifying tournament. And I remember sitting down with my teammates and all of a sudden I could feel a flare creeping up my body, starting in my legs and creeping up. And I knew if I didn't get out of that room in the next few minutes, like I wouldn't be able to actually get out of my chair. And I finally got to my room and I remember trying to put on a pair of compression pants to kind of limit the pain that I was feeling in my body. And in walked my roommate. I was naked. I was white as a ghost and I was crying. And I knew she was probably wondering what was going on, but all I could do was ask her to help me get into bed and not ask any questions. And then by 2012, I just realized, I could no longer keep this secret. My teammates were like my family and I couldn't do it alone anymore. I also realized at this point, like I had a big responsibility for myself and for all those that were suffering with this disease to use my platform. Social media had come out and I really felt that it was important for me to tell people what lupus was. And this is where the foundation really helped me. They'd helped me through the first years of having lupus. And I went to them and said, I really want your help on how to become an advocate, how to use my voice. And the relief I felt by just openly talking about what I had and how I had been suffering, it gave me energy and this strength. The support from my coaches, my teammates, fans that were in the stands was absolutely amazing. And I know that was the first time that I felt like I had support because I couldn't tell anybody before. And it was the most lonely period of my life. I was depressed so much of the time. And when I finally was able to talk about what I had and what I was going through, I know for a fact that support is what allowed me to play for 4 more years. And when I started to have flares, they were there to help me. And even if they didn't fully understand what was happening, they knew that they could be by my side. I could tell them what I was feeling and I didn't have to hide it anymore. And there were times where they were cutting my food because my wrists and my hands were hurting so bad, or helping me step out of a van or a bus because my joints were so locked up. So, I feel very, very lucky that I was able to play a sport at such a level for so long. But I believe in my whole heart that it was because of the sport that I had behind me, helping me along the way. I know my family was there from the very beginning. My husband was the one telling me it was okay when I went to try to go work out, and I felt like I was going to fly off the back of a treadmill because the fatigue was so much. And my doctors, who were always there supporting me and supporting my decision to keep playing, even though I know every single time I saw them, they were wondering how much longer I was going to keep playing. My coaches who trusted me, my teammates who had my back and were always wanting to learn more about what lupus was. And then I retired in 2015. So I've been retired for about 5 years. And I was fortunate to play in 3 Olympics and win 3 golds and to win a World Cup championship. And now I have 2 beautiful children who are 7 years old and 4 years old. And I continue to fight this disease every single day. I deal with extreme fatigue, joint pain that sometimes doesn't allow me to even walk around my neighborhood, brain fog. I have a butterfly rash that now never goes away. And there are days when I'm completely depressed or fear the worst. But those are the days that I lean on my family and my friends the most. And I remind myself that it's okay to give me time. I forget that being a mom, there's a lot of mom guilt, and I find myself not doing things that are best for me sometimes. And then I get stressed and I have this feeling of being overwhelmed. And those are my worst enemies, because that's when flares hit, when I'm completely overwhelmed and stressed out. And those are the times that I have to allow myself to give in and let go and tell myself tomorrow is a new day. It became my motto for myself every single time when I was playing. If I had flares and I couldn't get my 100% that day, it was, you know what, tomorrow's a new day. Let's see what happens tomorrow. And my strength comes from all of you that are going through the same thing or worse and continuing to fight. You know, when I was playing, my why was that I had the passion to play soccer. I loved what I did. And now it's my why is my kids. I want to be as healthy as possible for them. And I continue to focus on what I'm eating and what I'm doing to stay active. But it's become more difficult when you become a mom. I find myself picking off their plates, these, foods that aren't as healthy for me, or I forget to eat because I'm so busy. But the thing is you have to make sure you're focusing on you as well. And when I can do that, I try to stay on course. I plan my meals in advance. I finally made myself start eating leftovers, which I never did before. And when I eat something I shouldn't, I don't give in. I think that's the biggest thing, is so many people, you get so upset by yourself, like, oh, I didn't stick with this. And to be honest, you didn't, but tomorrow you can, or the next meal you can. It's not the end. And I think that's really has helped me through this last 5 years of really, especially last 5 years of just trying to make sure I'm eating the best way possible and working out. That's what I did for a living. But since retiring and becoming a mom, I found that is becoming harder and harder. And the best way that I have stayed on track is I get somebody to do the workout with me. I find a friend who's willing to lift with me or ride the bike or go for a walk. Because, even during COVID, I did it virtually with a friend. We would do the same workouts in our own homes and then call each other when we were done that night. Did you get it done? Holding someone accountable always has helped me. That's how I train. That's how I played. And that's how I continue to do it today. And then the other thing too, is if you have, trying to do a 30-minute workout, you can do it for 15 minutes in the morning. You can do it for 15 minutes in the afternoon. And that's a total of 30 in one day. I think we find that we have to do it all at one time to make it feel like that was actually a workout. But I have learned over the last couple of years, my kids will interrupt me all the time. And the best thing for me to do is give into that and then come back and do it when I have 10 more minutes to finish it off. And I still feel like it was a win for me. So, the biggest thing that I've learned from all my years of playing is just to be good to yourself when you don't feel well. Go ahead and let yourself rest, because pushing through, it makes it worse. And I've learned that through my years of, okay, let's have an easy day today. And when I do feel well, then I'm going to go a little harder. But I think, the most important thing to stay healthy, keep heart healthy, is just to really be true to yourself, really understand where you are, your body, and be good to yourself. And I know that together we can all make this difference and we can find a cure. And until we do, we must continue to support each other and not be afraid to ask for help. I've been a part of a team my whole life, and I think the most successful ones that I was on were the ones that we had each other's backs. And as an advocate and a warrior, I promise I know that I'm going to keep fighting, and I know you guys will too. So thank you for allowing me to speak today.
Wow. Well, thank you for sharing that story. And I mean, I'm blown away. And yeah, thank you for all your support and for being a great advocate. You know, I was just jotting down some notes from your talk, and I'm sure people on the line, or at least going into this webinar, would say, oh, professional athlete, professional soccer player, how could I ever relate to, someone like that? But, your story is the same story I feel like we hear a lot. And, whether it's the confusion and fear around being diagnosed and not knowing what's going to happen, but then almost the parallel between, the soccer field as your workplace and being, maybe scared or fearful to let your coaches or your teammates know for reprisal or for whatever the reason.
Right.
I think those are all things that, lupus warriors on the call today, and for people that we, advocate for, experience all the time. So I think it's just really, really fantastic that you shared that, and thank you. And yeah.
I think, just sharing our journeys, everybody has their own journey. And I think that once I kind of started working at the foundation and meeting more and more people with lupus, there's just such a great support system. And I think just really rely on them and let them carry you sometimes. And I don't think that's a bad thing to happen, is when you're willing to ask for help.
Absolutely. Well, I'm going to try to shift gears a little bit from that. And Shannon, if you don't mind staying on camera just for one more minute. I know we're running out of time, but I want to make sure we ask at least one question to our panel. So if our panel could just turn back on their videos, add some spotlights here. And so Shannon, I know, staying active, that was your job, and exercising and, and being an athlete. How did you stay motivated? So, on kind of those hard days where maybe you didn't want to go out of bed or you were having a flare. I know, just for anybody that can be hard, but if you have lupus and that's going on, it can be even harder. How did you stay motivated even on probably those hardest days?
The hardest days were the worst. There are definitely times where even just picking your head up off the pillow seemed impossible. But I think, it's just, you have to find that why. And I think I always had that with soccer. I wanted to pursue it. I wanted to be good at it. I wanted to go out and do those things. My kids, I hear them in the other room and it's like, okay, I want to be there. And so I prime myself off. I might not have a perfect day, but I'm going to be present and the best that I can. And I think there's always been a perseverance in my background of that's what I do. And it's really important to have that. It's always a strength that gives, I rely on when I am in my worst. So I think it's finding out what your why is and using that consistently, and looking at the positives of today might not be a good day, but tomorrow will be. And I think if you kind of have that positivity, it's going to help you a lot.
Mm-hmm, mm-hmm. Yeah, absolutely. I'm just looking in the chat. You mentioned about your kids and trying to do it all. And I think just, being realistic and doing what you can. So thank you. Well, we're going to do kind of a lightning round here since we're running out of time, but I just want to ask, maybe we'll go in order of our speakers, but if you had to impart one nugget of wisdom from your talk or, on our topic, what would you say to our audience? So Dr. Zack, I'll start with you.
One nugget, huh? Partner with your doctor. Make sure that you're speaking, regularly and honestly with them, and they to you. Find somebody that you really like to be taking this journey with you.
Great. And Dr. Oates?
I second that, because if you don't have a trusting relationship, it's difficult to be honest when you're having difficulty with your medication, or you're concerned about it, or can't pay for it. Because the one thing from my talk is making sure that you keep your disease under control, and that is a two-way street and a collaboration with your doctor. And the other is to live a healthy lifestyle as best you can. And I like the idea of starting slow and working your way up to it.
Dr. Lee?
Yeah, I think it's important to know that, we're here. We as physicians are here for you. We go into rheumatology for a reason. We want to work with people with chronic illness and help you feel the best you can be. So as I mentioned before, and everyone says, find someone you can really be honest with. I know I appreciate it when people fess up to me, they email me or they send me a patient message and say like, oh, by the way, actually, I stopped my medicine and this is the reason why. And I want everyone to know that there are actually more medicines coming down the pipeline. So don't feel like just because you didn't tolerate one well that you're a failure. There's many medicines and they work differently for everyone. So a little patience and communication can go a long way.
Mm-hmm. Great, thank you. Well, Shannon.
Yeah, I would just say, kind of close to Dr. Lee, is find support, find those people that are there to understand, and maybe they don't know exactly what you're feeling, but they're there for you to talk to, and they're there for you to just hold your hand when you're not feeling great. So I think those are so important. And then the last little thing I would be, again, just reiterating, be good to yourself. You're going to have bad days. You're going to have days where you feel like you failed today of being a mom or a dad, or it just go easy on yourself, because I think when you do that, you will gain so much more with your health and everything else. So.
Great. Well, thank you all, to our panel and to our presenters. I have just one more slide to wrap up. Great. So again, I just want to thank our speakers for joining us today. And if you're attending live or watching the recording, your feedback is just so important, and we value it highly. So it helps shape our programs, future programs. So we'd like to know what you thought of today's event and hear more about what type of content you'd like to see. So I know QR codes are making a comeback, so you can put your cell phone over the video screen there, and that'll pull up the survey. Or you can click that link and share your feedback there. It should only take about 10 minutes. But again, we really, really appreciate it. Thank you to Dr. Oates, Dr. Zack, Dr. Lee, and to Shannon for their time and for your presentations and for sharing with us tonight. So thank you so much. We really, really appreciate it.
Thank you, everybody.
Thank you.
And everyone have a great evening, and thank you again.
Thanks.